On this video, I'm gonna give you a thorough nursing procedure discussion about your ECG. Yes, paano mo nga ba gagawin yung ECG at saan mo nga ba ilalagay yung tamang placement ng mga probes and electrodes? All of that and more in one video. If you wanna know more about that, stay tuned. Welcome back to my channel. If you're new here, my name is Neil Gavin. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals with their studies. If that's something that you are interested in, consider subscribing. If you're already subscribed though, thank you so much for your love and support. I see you. I upload my nursing educational videos every single week. Don't miss that out. Subscribe now, hit that notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more content like this. Without further ado, let's jump into the video, nurses. Hello everybody! Welcome back nga sa aking channel. For today, isang panibagong nursing procedure ang alay ko sa inyo because on this video, I'm gonna give you a thorough discussion parang rhythm ng ating ECG procedure. Yes, electrocardiogram nga po. On this video, I'm gonna talk about ECG intervention or ECG procedures that we commonly do in the area. Alam ko na marami pa rin kasing nalilito at maraming kailangan ng refresher kung paano nga ba gagawin yung ECG. This is actually a very helpful skill sa ating mga nurses, lalong-lalo na sa lahat ng mga nagtatrabaho dyan sa ER, sa EMS, o kahit saan pa sa ward. This is actually a very helpful skill. Kaya naman, on this video, I'm gonna give you a thorough discussion about it. I'm gonna discuss to you the equipment, the special considerations, the actual procedures, the step-by-step procedure, and including the documentation. In order for me to do that, I will need to switch back to my PC and I'll see you guys in a bit.
Hi everyone! Welcome back sa ating formal discussion ng iyong ECG Electrocardiography, Nursing Procedures and Skills. Oo nga po, medyo natagalan yung ating uploads. Pasensya na, medyo naging busy lang ako. Pero don't worry because I am back on track. Like I said, this is another entry natin sa ating Nursing Procedures and Skills lecture videos, Nursing Study Guide. Kung hindi mo pa napapanood yung other Nursing Procedures and Skills video lectures na ginawa ko for you, panoorin mo siya, ililink ko yung actual playlist sa description box or kapag nagpop-out yung icon button, i-click mo lang yon, magpa-pop out siya kasama nung mga iba ko pang playlist sa nursing. Okay, simulan na natin to. Wag na tayo magpatumpik-tumpik pa. Okay, what are the objectives of our today's discussion? I'm going to discuss to you, I'm gonna give you introduction, the equipments that you're gonna use in, conducting your ECG, implementation, special considerations, and of course, documentation. What is the proper documentation when it comes to ECG procedures? Okay, so handa ka na ba? Let's begin. So, introductions. Isa munang overview. Okay. So, coronary heart disease remains a leading cause of mortality worldwide. Prompt recognition and treatment of acute coronary syndrome such as ST segment elevation, myocardial infarction, yung ating STEMI, and non-STEMI acute coronary syndrome can reduce and prevent cardiac arrest. Okay? Now, let me also give you this information. Electrocardiography, one of the most valuable and frequently used diagnostic tools, displays the heart's electrical activity as waveforms. Ito siya, waveforms, diba? Now, impulses moving through the heart's conduction system create electrical currents that can be monitored on the body's surface. Electrodes attached to a patient's skin can detect these electrical currents and transmit them to an instrument that produces a record of cardiac activity known as electrocardiography or ECG. Ito nga po siya. Impulses moving through the heart's conduction system create electrical currents that can be monitored on the body's surface. Electrodes attached to a patient's skin can detect these electrical currents and transmit them to an instrument that produces a record of cardiac activity known as an electrocardiogram, ECG. Okay, and in addition to that, an ECG can be used to identify myocardial ischemia and infarction, rhythm and conduction disturbances, chamber enlargement, electrode imbalances, and drug toxicity. All right, now a standard 12 lead ECG uses a series of electrodes placed on the extremities and the chest wall to assess the patient's heart from 12 different views. Kaya nga tayo merong 12 leads, di ba? Okay, now the 12 leads nurses consist of 3 standard bipolar limb leads. Ano-ano yon? Yung iyong 1, 2, and 3. Unipolar augmented limb leads, yung iyong AVR, AVL, AVF. And 6 unipolar precordial leads, yung V1 to V6, diba? The limb leads and augmented leads show the heart from the frontal plane. The precordial leads show the heart from the horizontal plane. Don't worry because sa mga susunod na slides, tatalakayin natin yan in details. Alright. So, ano-ano ba yung mga equipments na gagamitin mo when you are going to conduct ECG? Remember that for you to maximize your time and, conserve your energy, you need to gather all the equipments prior of going to the patient's bedside, kung ikaw nasa ward or kung ikaw ay nasa ER, para naman isang bagsakan na isang puntahan lang. Okay? So, ito na yung mga gagamitin mo, girl. Now, mind you guys, this is according to Lippincott procedures module o yung guidelines. Okay? So, ano yung mga gagamitin mo? Meron ka dyang ECG machine with recording paper, of course. You have your disposable pre-gelled electrodes. You have your soap and water, washcloths, bath blankets or sheet, facility approved disinfectant. Optional po ito, disposable head hair clippers, single patient use scissors, indelible marking pen, gloves, alcohol pad, yung ating 4x4 or 10 centimeters by 10 centimeters gauze pads. Okay? Anong basa dito, guys? Pre-gelled. Okay, pre-gelled ha, hindi pre-gelled, pre-gelled electrodes. Alright, so yun ang mga equipments mo. Ito naman yung implementation na tayo, nurses. Medyo mahaba ito. Ready ka na? Let's begin. Alright, so unang-una mong gagawin since nursing procedures ito, para nagre-ret them, okay? Na una, you need to verify the practitioner's order. I-verify mo muna sa order ng doktor kung meron ba talagang order for ECG, kasi kung wala, it will be a waste of time and resources, girl. Gather and prepare the necessary equipment and supplies. Anong rationale behind for you to actually save time and effort? Ano pa? Perform hand hygiene. Hand hygiene po para maiwasan ang spread of infection. Simple. Put on gloves as needed to comply with standard precautions. Pag may mga contact precautions, normally sa hospital talaga gumagamit tayo ng gloves, okay? Para rin infection control. Okay, confirm the patient's identity using at least 2 patient identifiers. Anong rasyonale? Para malaman mo na ito nga talaga ang patient mo. Ano to isa sa mga patient's right you need to know, or isa sa mga procedures ng mga policy ng isa sa mga standard na procedures or protocols ng mga SOP ng isang facility, di ba? Unique identifiers. It could be the patient's MRN number, it could be the bin number, it could be the hospital number, it could be the patient's full name. You need to ask your patients for his or her identity. All right, provide privacy. Siyempre, provide privacy. You need to make sure that the patient is having privacy kasi i-expose mo yung kanyang chest part. So you don't want to invade the patient's privacy, okay? Next, explain the procedure to the patient and family. This is actually gonna make increase patient cooperation, and this is one way for you to establish rapport to your patients. Minsan kasi yung mga pasyente natin na ginagawa ng ECG, first time nila yon, hindi nila alam, akala nila masakit, akala nila may kuryente. You just have to explain to them that this is painless, this is not where I'm not gonna give you any electricity in your body. All you gotta do is to breathe normally, and that way ease sila, and you will gain cooperation, patient cooperation. Next, raise the bed to waist level before providing care to prevent caregivers back strain. Ayaw mo masyado mababa, bakla. Kung masyado ka nakayuk-yok, o di ba, ang back injury mo, ingat ka, yayaman ka pa. Paano ka yayaman kung meron kang back injury? Proper ROM, range of motion. Alam mo yon? Next, place the patient in the supine position in the center of the bed with the arms at the patient's side. Supine position nga po ang preferred position natin sa ating mga pasyenteng for ECG. Hindi po pwedeng semi-fowlers because that could actually affect the patient or the result of the ECG. Next, raise the head of the patient's bed if the patient desires to promote comfort. Ideally supine, pero kung ang pasyente mo is merong contraindicated ito sa pasyente mo at ang iyong pasyente ay actually may difficulty of breathing, you might want to put like a pillow on the patient's head, on the back of the patient's head, para naman to facilitate opening the airway and stuff and to promote comfort. Next, ensure that the patient's arm and legs remain relaxed to minimize muscle trembling. Naalala mo sa ECG kapag nagbabasa kami, sa nag-error siya, naglalagay siya ng notification na muscle tremors. Yun. And which can cause electrical interference. Electrical interference po yung tawag doon. So what you're gonna do is to, just instruct your patient to put his or her hand on the side and avoid, doing unnecessary movements and just relax, okay? Most probably yung ECG kasi natin nagte-take lang yan ng 5 to 10 minutes kasama na yung application. All in all, simula sa pag-i-explain ng procedure sa pasyente, okay? Next, expose the patient's chest. Very important. Saan mo ilalagay ito? Sa noo o sa paa? O ilalagay mo rin sa paa pero hindi mo siya ilalagay sa dila. O kailangan sa chest. Arms and legs. Ito po yung area ha. Chest, arms, and legs. And then cover the patients appropriately with a bath blanket or sheet. This is one way for you to, preventing exposure of, areas of the body of the patient that is not really needed. Next, select the electrode sites on the patient. Saan mo ba ilalagay? Mamaya malalaman mo. Proceed na tayo. Continuation na ito ha. Clinical alerts po. If the electrodes are placed incorrectly, the ECG tracing can be distorted sufficiently to cause a misdiagnosis. Kaya importante, nurses, na tama ang placing ng ECG electrodes mo. Huwag susyong-syong nga ha. Mamaya bibigyan kita ng madaling paraan kung paano mo siya maaalala. Okay, this can result nga to inappropriate treatment. Okay, if a selected electrode site is excessively hairy, paano naman yung mga mabubuhok? Clip the hair using disposable head hair clippers to promote what? Electrode adherence to the patient's skin. Electrode adherence. Pwede mo siyang i-clip. Kung ayaw ng pasyente mong i-shave yung area na yon, i-clip mo na lang, girl. Kasi may depende kasi yan sa paniniwala na yung pasyente, ayaw mo naman silang mai-violate. Next, wash the electrode sites using soap and water and washcloth. Wash down. Mark the electrode sites with the indelible marking pen if serial ECGs are likely. Ito lang naman ay kapag nahihirapan ka talaga ma-figure out or kung gusto mong ma-make sure na tama yung placing mo, okay? Next, apply disposable pre-drilled electrodes to the patient's inside forearms and to the medial aspect of the angles or calves. Limbs leads should be an equal distance from the heart and in about the same place on each limb. Ano pa? Apply the pre-drilled electrodes directly to the prepared sites as recommended by the manufacturer's instructions. Importante rin na alam mo kung ano yung brand ng ECG nyo sa hospital o sa area mo at kung paano yung nagpa-function. Different manufacturers kasi have different instructions. Different products have different, or machines have different instructions. Depends on the manufacturer. Next, apply disposable electrodes on the patient's legs with the lead connections pointing superiorly to guarantee the best connection to the lead wire. Next, apply a pre-drilled electrode at each electrode site on the patient's chest. Ito na, applying chest electrodes. Ito, padadaling kong buhay nyo ha. Bibigyan ko kayo ng visual representation. Saan ba i-apply yung V1 to V6? Ito na tayo, okay? Huhu! Nakakahinga pa ba? Nakakahinga pa? Oo naman. Nurses tayo. Number 1, V1. So V1, color red ito ha. Pag sinabi mong V1, saan mo siya ilalagay? Nilagay ko rin siya dito. Fourth intercostal space at the right border of the sternum. Fourth. So bilangin mo siya. Normally, kapag kinapa mo, nagpalpate ka dyan, sa baba ng clavicle bone mo, that's already your second intercostal space. Bisaya ka, girl. Second intercostal space. So ang bilang mo dyan, diba? So, sa baba ng clavicle bone mo, normally, hindi mo na ba nakakapa na yung first intercostal space. Pag hindi mo yung nakapa, yung right na, yung space sa baba nun, yun na yung iyong second intercostal space. So, ang bilang mo niyan ganito na. So, hindi mo nakapa yung 1. 1. So, 1, 2, 3, 4. Fourth intercostal space. Nasa midline siya ha, sa may sternum, sa border ng iyong sternum. Next. Ano na, yung yellow, saan siya sa V2. Itong kulay na ito ay depende to ha. May iba-iba kasi, kagaya sinabi ko, manufacturer, iba-iba yung kulay nila. Pero mapapansin mo dun sa electrode, may nakalagay naman doon, may legend. May V1, V2, V3. Sundan mo lang yon. It doesn't have to be red, it doesn't have to be yellow. Nilagay ko lang tong kulay na to para talagang may visualization kayo. May visualization tayo kung alin ba siya para hindi malito-lito. So V2, same pa rin ang placing nun na, basta V1, V2. So V2, saan siya? Fourth intercostal space at the left border of the sternum. So kung nakabit mo na yung V1, yung katapat nun, sa right side to ha, yung V1 na right side, V2 nakatapat nun, yun na yung V2. Ngayon, syempre ang kasunod, chronological order tayo. Pagtas ng V2, V3, wrong. Para mas maging madali sa'yo ang gawin mo, ganito. Okay lang naman yun kung kabisado mo na talaga. Dilagay mo na yung V3. Pero kung gusto mo talaga yung mas accurate, ang tamang placing ay uunahin mo yung V4. Sasabihin ko sa iyo kung bakit. V4, saan siya makikita? Fifth intercostal space at the left mid-clavicular line. So this is my right side, this is my left side. Okay? So V4, saan siya? Fifth intercostal space. So, ang bilang niya, 1, 2, 3, 4, 5. Tama? So, 1, 2, 3, 4, 5. Fifth intercostal space, mid-clavicular. Mid-clavicular sa gitna ng clavicle. Okay? So, kapag kinabit mo na yung V4, malalaman mo na mas madali na sa'yo na, V4, V3. Ano lang siya? Perpendicular. Ganito yan, halfway between V2 and V4. Dito siya. So, trick yun actually para mas maging madali sa yung pagkakabit, mas maging accurate yung pagkakabit mo ng electrodes ng ECG. Again, V1, V2. Pag nakabit mo na yung V2, hanapin mo yung fifth intercostal space at the left mid-clavicular line. Same side. Mid-clavicular. Palitan ko nga ito. Pen. Mid-clavicular. Ito siya Ayan, mid-clavicular. Diba mas madali? Proceed na tayo. V5, orange. Ito siya. In the horizontal plane of V4, horizontal ha, horizontal. Ito, katapat lang siya. Of V4 at the anterior axillary line or halfway between V4 and V6 if the anterior axillary line is ambiguous. So, kasunod ng V4, V5. Dito lang siya, halfway, horizontal plane of V4. Okay? Next na tayo. V6. Last na to. In the horizontal plane of V4. V4, same line lang sila technically. Same line. At the mid-axillary line. So, ito yung iyong axilla sa gitna. Tapos, ikabit mo yung V5. Ayun na yun. Diba? Mas madali. Again, this is how you're gonna place your electrodes from V1 to V6. Okay? Malinaw yon? Malinaw po iyon. Now, nurses, to ensure proper placement of chest electrodes, use palpation to locate the correct intercostal space. Palpate point at which the sternum attaches to the clavicle, the suprasternal notch, kung tawagin natin. Then palpate down to identify the sternal angle, which is the bony prominences at which the second rib attaches to the sternum. The space below the second rib is the second intercostal space. Continue to palpate down the patient's sternum, counting the ribs and intercostal spaces to find the appropriate location for the chest electrodes. To ensure accurate test results, apply chest electrodes as follows. Ito nga po. So, V1 to V6. Malinaw yon? Screenshot mo na, baby, kasi magpo-proceed na tayo. Okay. Now, Ito pa mga mga additional information mo ha. Connect the lead wires to the electrodes. Note that the tip of each lead wire is lettered and color coded for easy identification. The white or RA lead wire goes to the right arm, the green or RL lead wire to the right leg, and the red or LL lead wire to the left leg, the black or LA lead wire to the left arm, and the brown or V1 to V6 lead wires to the chest electrodes. Diba? Black over red, white over green, sky over green. So yung black, saan mo siya ilalagay? Sa left. Black over red, left, 'di ba? Ang red mo, saan mo siya ilalagay? Yung red limb mo, saan mo ilalagay ang yung red limb, 'di ba? Sa left leg. Okay? So black over red, white over green. Okay? Isa sa mga mnemonics natin sa nursing. All right, next. Instruct the patient to relax and breathe normally. Kasi pag nagpigil ang mahinga ng pasyente mo, magkakaroon ng false positive reading. Ayaw mo nun. Instruct the patient to lie still and not to talk when you record the ECG to minimize artifact. Press the auto or start button as shown below. The ECG machine records all 12 leads automatically, recording 3 consecutive leads simultaneously. Some machines have a display screen that allows you to preview waveforms before the machine records them on the recording paper. Observe the tracing quality. Repeat ECG recording as needed. Normally sa ospital sa ginagawa ko, I run the ECG twice. Just in case para may magkaroon ng, alam mo yon, yung reserba, or kapag pangit yung kuha sa umpisa, ulitin ko siya sa pangalawa. 2 or 3 ECG readings kapag gano'n ang practice ko. Now, additional information to ha, when the ECG machine finishes recording the 12-lead ECG, remove the electrodes and clean the patient's skin. Huwag mo mong hayaan nakatiwangwang yun, may mga gel-gel pa dyan, ayaw mo yan. Disconnect the lead wires from the electrodes and dispose of electrodes as indicated. Return the bed to the lowest position to prevent falls and maintain patient safety. Remove and discard your gloves if worn. Wag mong dalhin hanggang lunch, cafeteria ang ang gloves mo, girl. Perform hand hygiene. So, nag-hand hygiene ka sa umpisa, nag-hand hygiene ka rin pagkatapos. Put on gloves as needed. Clean and disinfect reusable equipment according to the manufacturer's instructions to prevent the spread of infection. Remove and discard your gloves. Very important. Perform hand hygiene. Paulit-ulit na naman tayo. Document the procedure. Ang daming hand hygiene and ang daming gloving. Sa pag naglilinis, pag nilagay mo na, kapag naglinis ka na ng instruments, and right after mong matapos ang iyong procedure. Okay? Alright, special considerations na malapit na tayo matapos, nurses. Ano-ano ba yung mga dapat mong tandaan? During the procedure, nurses, instruct the patient to breathe normally. If the patient respirations distort the ECG recording, instruct the patient to hold their breath briefly to reduce baseline wonder in the tracing. If the patient has a pacemaker, very important though, you can perform an ECG with or without a magnet according to the practitioner's order. Again, i-verify mo pa rin ang doctor's order mo, lalo na sa mga pasyenteng may pacemaker. Be sure to note the presence of a pacemaker and the use of magnets on both the ECG strip and in the patient's medical record. Naalala mo kapag nag-i-instruct ka or bago ka magawa ng ECG, ina-ask mo yung pasyente mo na to remove belts or to remove jewelries or rings or coins kasi it can actually make or alter the result of your ECG, can produce artifacts. Ganun din sa ECG mo, na paggagawa ka ng ECG mo sa mga pasyenteng may pacemaker, kasi ang pacemaker natin usually that is a metal made. So ayaw mo yung mag-alter ng effects. So, ang gagawin mo, you just have to take note of it and verify that with your doctor's order. Now, record the ECG with the patient in the same position each time because different positions may cause differences in the tracings. Different positions may cause differences in the tracings. So kung supine mo siya kinuha nung umpisa, supine mo siya kukunin all throughout. If another position is required because of the patient's condition, document the position used on the tracing and in the patient's medical record. Pwede naman, pero you just have to note it in your nurse's progress notes. Paano mo siya ito-documents? Malapit na tayo. Paano documentation mo ng ECG reading? Ito siya. Sabi ko sa inyo, I got you eh. Okay, first one, document in the patient's medical record the date and the time the ECG was performed and any significant responses by the patient. Verify the date, time, and the patient's name and assign the identification number on the ECG itself. Note, bago tayo pumunta dito, bakit importante ito? Kasi malay mo, abnormal yung result or whatever, normal yung result, hindi pala yung tama dun sa pasyente mo, girl. Hindi pala yun para kay patient A, para pala dapat yung ECG na yun kay patient B. So you need to make sure na kung ano yung nakalagay na patient information sa ECG strip mo or sa ECG paper mo, sa result mo, yun talaga yung para doon sa pasyenteng yun, sa chart, attach mo yun sa document ng iyong pasyente, okay? Para maiwasan yung misdiagnosis and mismanagement. Note any appropriate clinical information, positioning changes, and calibration variations on the ECG tracing and place it in the patient's medical record. Document teachings provided to the patient and family if applicable, their understanding of that teaching, and any need for follow-up teaching. Alright, so yun na nga, doon na nga natatapos ang ating lecture for today. Thank you so much, nurses. I hope nga ay nakatulong ito sa iyong pagmamaster or pagre-refresh ng iyong nursing procedures when it comes to conducting ECG to your patients. Please like, share, and subscribe to my channel for more nursing educational videos. Let me know if you have other nursing topics that you want us to do. Comment it down below. Abangan nyo po yung mga next video natin ha, kasi marami po tayong i-upload in the future. I also want to grab this opportunity to please to invite you to, kung hindi ka pa nagla-like, i-like mo na, and to help me out, spread the news. 6,000 na nga tayo. Help me out, spread the news about my channel. Ipamalita mo na sa Radyong Sira ang pinakabago, pinaka-fresh, pinakalibreng nursing review center sa balat ng YouTube.
Thank you so much, you guys, for watching. I hope you learned something. Help me grow my channel. You are already here. You might as well subscribe. Hashtag Team Kulta. Give this video a big thumbs up and share with your friends. Let me know what you guys think. You put them down in the comment section below. Also, don't forget to check out the other playlists I created for you. I'll be putting the links on the description box, or simply click this icon button right here. Let's connect. Follow me on all my other social media accounts. Everything is at Neil Galve except for my TikTok account, which is Neil Galve Official. I would also like to invite you to please follow, subscribe, and like my Facebook page. It's Neil Galve. I'll see you again next time.